Good afternoon. Can everyone hear me okay?
Yes.
Yes.
Okay.
Yes.
It is 2 o'clock and our waiting room is cleared. I believe I counted 3 TAC members. I had Keith, Troy, and Jacob. Did I miss anyone else while they were logging in?
I know that Joe Mr. Pruitt will not be able to make today's meeting. He had something come up at the last moment, so he will not be able to get on.
Okay, thank you. You need one more for a quorum, so we can wait a
Yeah,
moment if you'd like. It's just 2:01, or you can
let's-
proceed and I can come back and let you know if anybody else joins.
Let me send a text to a couple people and see if I can get them on, because today's meeting is very important and we need to get business done.
Absolutely.
Troy, do you by chance have Dana's information at A and B where you could text her by chance?
Yeah, I'm working on that right now, Chief.
Okay, thank you. All right. In the interest of time, while we're waiting for two others to get on, and with Aaron monitoring to see if they are able to jump on, we'll go ahead and get started. Obviously, we don't have quorum yet, so we'll wait to see if we hear back before we take any action on anything. In the meantime, out of the members that are online, are there any minutes discussions, or is there anything from the minutes that we need to adjust from the last meeting, or we obviously can't vote on them right now, but if there is something that we need to change, let's hear about it now. I didn't see anything in them that rang out to me. Say in, Jacob.
I did not see anything either.
Okay, great. Well, unless Troy has anything, we will just go ahead and put that on the back burner until hopefully we get two more on, or at least one more on, in order to take a vote on that. So let's go ahead and jump into old business and review new documentation from DMS regarding the Medicaid PCS form. This is the form that we had talked about and had passed around, getting input on in order to replace the pre-certification, pre-qualification for non-emergency Medicaid medical transportation. Aaron, do you all have a copy of the form as it's been adopted, or as it is up for adoption?
I was not on the approval email. Stuart, are you on the call and might be able to share that for me?
Yeah.
I just know that it was approved. Thank you so much. Give me
Yeah.
just a second. I'll make you a co-host.
Okay. Thank you, Aaron. So yeah, we submitted it I emailed it on behalf of all the MCOs asking DMS approval, and DMS, the appropriate division that's over managed care, essentially did approve it. And did confirm that we do need to send, anytime we quote, change the way we do business with a provider, a managed care with a provider, we have to notify the provider. And also same thing with prior authorization, if you're changing prior authorization. So It was approved by DMS, and then I know like with WellCare, we're trying to operationalize it because we have to set up business rules essentially, like our claims processing team, and they have to like set up, the whole process, spell it out, vet it, and then, do training and stuff. So we're in the process of doing that. We got another meeting Thursday. I have our notices drafted. We're shooting for 1124 go live, and I'm hoping Thursday to confirm that, and then I would submit the notice because like I said, we got to send the notice to DMS for approval, which will be no problem, obviously, but we have to do it. So that's what we're shooting for. But DMS did indeed approve the form for use for all the MCOs, and I think one MCO is not going to use it at all. I think they don't do PA anyway. But anyway, DMS did approve it.
Okay, great. And then from your perspective of having the go live date of January 1st of 24, is that a date that all of the MCOs would like to go with, or does everybody feel that you can meet that date, or do we need to look at pushing it out because of any one particular MCO that has a larger process they need to go through in order to get it approved?
And a given MCO could go live sooner if they want. I mean, that's what I'm just thinking. We wouldn't have to all. I mean, I guess it would make it neater and cleaner for everybody. But I think if a given MCO could do it quicker, that they would have that liberty. Just throwing that out there.
Sure. Real quick, not to change the subject, but Aaron, did you see Troy's comment that Dana is on via cell phone? She's got an emergency she's dealing with and can only come on camera to be able to vote.
Yes, sir. I was going to step in and see if you saw that as well when you and Stuart were finished.
Very good. Thank you so much, Aaron, for keeping up with that. Okay, so I think if we could have.
I
one
apologize.
starting
It looks like Joshua is also logging in.
Very good, great.
So if you guys want to go ahead and approve your minutes as soon as he gets in, which it looks like he's in, you could do that, and then that's behind you.
Okay, yeah.
Thank you. Apologize, everyone.
That's okay. Thank you for jumping on. Appreciate it. All we've discussed so far, Joshua, that requires a vote is to approve the minutes from our last meeting. We discussed it briefly and had determined that there were no updates that needed to be made. If you saw anything that needs to be updated, let us know real quick. Otherwise, we'll go ahead and vote to accept the minutes from our last meeting.
No, sir, I did not. Thank you.
Okay, great. So all those that are in favor of adopting or accepting the minutes from the last meeting signify by saying yes.
We need a motion to approve first.
Yeah, there you go. I'm sorry. It's been a long day, guys. I appreciate it. I'm sorry. Is there a motion to accept the minutes?
So moved.
Second from Jacob. All those in favor?
Aye.
Any against? No opposed. Minutes pass. Thank you. Okay, so going back to what Stuart was discussing with the time frame, they're shooting for January 1st. Do any of the committee members have an issue with us waiting that long? Obviously, if they've got to have that long to get it through their process, then it just needs to wait a little bit longer. But I'm of the mindset that instead of doing about one health organization doing it on one date and another health organization doing it on a different date, if we can try to keep everybody on one specific date so that we can put the word out to all the EMS providers that on this specific date, we can begin using the Medicaid PCS form. I think that might be a little bit more palatable to everybody. Troy, what's your thoughts on that?
I agree. I think we should do all of them at one time, and that would give us time also to send this form that's approved out to the EMS services to train their staff as well. I mean, we got to do training also. So,
Sure.
Yeah, we got to learn how to use it and when to use it. So I think we just come up with a hard date of January 1st and go with that.
Sure. I think that's a good thing. And then if there are any of the MCOs that are online, or perhaps if they're not online, that you all talk to, that say for whatever reason they can't make January 1st, please reach out and let us know. But otherwise, we want to get this adopted and into the use as soon as we can, for the sake of the EMS providers. The form is up on the screen now. For those that may not have had a chance to see it, hopefully everybody's had a chance to see it. But this form is very much like the Medicare PCS form is, with a few differences. Obviously, instead of a Medicare number, it asks for a Medicaid number. Like I said, I believe there was one or two very small changes. In general, it's a very easy form to be able to use for those that have not had the opportunity to use it. EMS has been using a form that is very much like this for a number of years. So from our training perspective, I think it's going to be very easy for our people to be able to pick it up and run with it. We just need to make sure our folks understand there is a small difference between the Medicaid form and the Medicare form, and when it is appropriate to use the Medicaid form, and obviously when to use the Medicare form. Is there any parts of the form that anyone has seen that causes grief or otherwise? Or is everybody okay with the way it is written? Like Stuart said, it's already been adopted, so it should be in its final form now. But if there's anything that's going to end up causing an issue, I'd rather us find out about it now, as opposed to adopting it and then potentially having to change it down the road.
Now, Keith, this form can be used for Medicare and Medicaid, correct? This new form can be used for,
Can we blow it up a little bit? I can't.
it's got Medicare and Medicaid
Okay,
numbers.
yeah, as long as it's got both the spaces on there for the forms, it should be okay for the same, because it's got the same conditions as the Medicare. And I believe the same people can authorize it, on the bottom, as far as physician, PA, nurse, social worker, discharge planner, and so on. So with that in mind, we'll go ahead and call for the question. First, can I get a motion to accept this form as written to be the Medicaid PCS form going forward?
So moved.
Motion by Mr. Walker. Is there a second?
I will second it.
Mr. Carroll seconds. Any discussion? Very good. All those in favor, please signify by saying yes.
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 Yes. Any opposed? Any abstentions? Very good. So moved. Thank you very much. Okay, now as far as thank you for pulling that back up, Aaron. As far as the procedure for using the policy, Aaron, I'm going to have to rely on you on this. Is this something that is changed in writing by DMS, or who actually documents the changes to the process in writing that we can provide to our EMS providers, showing the difference between the pre-authorization and now the PCS form?
I believe, and someone with more knowledge than I do, Angie, maybe if you're on the call, that the MCOs will send out provider communication about those processes. But as far as on the DMS side, I'm going to have to defer to someone else.
Okay.
Angie, can you help with that?
I'll try my best. Hi, I'm Angie Parker. I am with Department of Medicaid Services. As far as notification from the MCOs, they are to provide 30 days notice of any change to the providers. So they should be sending this notification to the ambulance providers
December 1, correct?
by December 1st, yes, for
Yes.
January 1st date utilization of the form.
Okay.
Yeah, this is Stuart again. I was gonna say, since it's essentially the MCO is changing, like if DMS said MCOs, you shall do whatever, that would be DMS. But since this is the MCOs each essentially changing the policy. It's our responsibility.
Okay, very good. Then really, I don't see where we would need to take any type of, a vote on the procedure since it's gonna be coming from each individual, MCO. And we can look for those, policies to go out on December 1st to all EMS providers. And is that, Angie, is that to all EMS providers that are licensed in Kentucky? And does that include all classes of licensure?
It's whoever the MCOs are contracted with.
Okay. All right, very good. All right, awesome. Clearly, today's meeting is not going to take 2 hours for us to get through. So I think everyone is going to have some time put back on their calendars today. Do any of the committee members have any questions regarding either the form or the policies and procedures going forward that we need to get out into the open today?
I guess I'm just wanting to make sure we get it right as far as sending it out to the EMS providers. I mean, I don't know if we should wait for the MCOs to do that, or if we can take it upon ourselves to help start training or rolling it out. I mean, we have two of the larger billing companies on the phone, and there's a couple more, but I mean, they could be doing training with this form and when and where you should use it. Is that okay, or should we wait for the MCOs to send that out? So
We've got a hand raised for iPhone. I'm assuming that might be Dana.
Dana, I bet.
Yeah, go ahead, Dana, if that's you or whomever it is.
I'm sorry. No, this is Dr. Cantor. I'm on 2 devices, so it looks like I'm here
Gotcha.
twice. But my question is, normally we have to have DMS approval prior to sending anything out to the provider. So since DMS has already approved this form, we don't need to go through that particular step on this form. Are we good to, Angie?
If the form has been approved, then yes.
This form, yes, this particular form has been approved by you all. So we, the MCOs, are ready to send it out without another ask of you all to approve it.
Correct.
That
If it's
makes-
been approved,
Yeah.
go right ahead.
Yeah,
Okay,
well,
good.
I mean, Dr. Cantor, excuse me, if we change the way we conduct business, we have to notify providers of that change. I think that's what we're talking about. The
Yeah.
form's been
But there's
approved.
always,
The
right.
notice, we still got to do the notice, and that has to be approved since we're quote changing the way we do business. That's my understanding.
Well, now I'm,
Not to confuse things. So, Dr. Cantor, the form is approved. The MCOs are to provide that information to your contracted ambulance services, excuse me. You, with that notification though, the information that you say, hey, come January 1st, this is the form you're to use. Well, I believe Stuart's talking about, yes, you would have to get the approval for us to say, we're sending this notification to our providers and this is what we're saying. It shouldn't be an issue at all, since the form has been approved. Just
yeah,
making sure
yeah. Okay, just gonna repeat what I think I'm hearing both you and Stuart saying. I do not need to upload this document to SharePoint asking you all to approve it prior to me sending it out before December 1 or on December 1,
correct.
because it's been approved by you all. I'm
That's what
gonna
I
use the same
understand.
form. I'm not, I don't see, I worked on it on our back end with the appropriate people, and I don't see any difference at all. So it's ready to go. I just want to make sure I don't need to ask you all, I don't need to upload it to the SharePoint site.
Well, I don't
Yeah.
read those,
Yeah.
but my assumption is yes, that's been approved. This form has been approved. Please move forward before December 1st.
Yeah, Angie, it was Jeremy Armstrong DeRoss on DMS's behalf who approved the form for all the MCOs.
I'm sure he did. So it sounds like it. So we're good to go. Dr. Cantor, just
All right, very good.
Hey.
And Troy, yes,
Would it be worthwhile for a message to go out from K-beams as well, just to notify EMS providers of this, if we can have K-beams do that as well?
yeah, I don't see a reason why they couldn't. We need to make sure we get the right form, the approved form, so that we're not sending out a variation that wasn't approved, but I don't see any reason why they couldn't send it out. And my guess is all of and to Troy's point, actually, the billing companies will probably send out a message as well to make sure that we saturate the services with the message that there is a change, because we clearly want everyone to be on the same sheet of music, and make sure that everybody's following the new process come January 1st. So I don't see any reason why they wouldn't. In fact, CAPA may decide to do something similar with agencies. So it just really depends on each agency, but I see no reason why K-beams couldn't send it out as well.
Should we come up with I don't know how to say this, guidelines, just a simple piece of paper that says use this for all non-emergency? I mean, I hate to say, should we have something like that, just explaining that's
Yeah, we can do an introduction form or an introduction page to the form, and also state in that introduction form that each MCO may have their own processes to follow, but this is the form we'll use that will go to the billing companies. But in the meantime, they will be receiving further guidance from their individual MCOs that they're contracted with. Yeah, that'd be no problem. I don't mind drafting something like that, and then I can send it over to you and the rest of the folks to take a look at.
I just thought the MCOs might appreciate that too, because we definitely want to make sure it's kind of standard. I would think you would want it standard across the board. I mean, I think most of them would use it the same way, but I just didn't know if that's something we need to create to help with that, facilitate that.
Yeah, speaking for WellCare, I think that'd be wonderful. I think it's a real good idea.
Okay, yeah, we can come up with that, and it basically be a talking point letter. Be pretty much verbatim based off of what we do with Medicare, but yeah, it seems like a doable thing. All right, we will go ahead and jump then from item 4 down to new business, which is discussion of the meeting tempo changing to quarterly from every other month. And this was a message that I had received from DMS indicating that other TACs had started moving. So instead of having a meeting every other month, it turned into a quarterly meeting. So I wanted to put that on the agenda for today to get everybody's feeling, to see if that is something that is tenable. Is that something everyone would like to go with? Would you prefer to stay with every other month? So the floor is open for comment on what the group feels. I will say that having the opportunity to do the every other month to get this process, the pre-authorization taken care of, was very nice, but this was probably the largest bite out of the sandwich that EMS providers needed to take care of immediately. I think one of the things that we will want to discuss going forward will be the reimbursement rates. But that is something we could probably do in a quarterly fashion instead of every other month. But again, I'd like to get the feeling from other members of the TAC and also the MCOs to see what your all's thought on that is.
I like to have quarterly. However, I think right in the middle of this going on, me personally, I think we need to have them a little bit more frequently, at least for the first couple of months till we get this on the ground and going, in case there was any issues.
Okay. Does anybody else have any comments one way or the other?
No, I'm in favor of going to a quarterly process. If we want to open it up in January and then go from there and see how it went, I mean, I would be fine with that, or however you all want to do it. But I think quarterly would be good.
And Keith, this is Erin.
Yes, ma'am.
Of course, the schedule is completely up to the TAC members.
Mhm.
I know we're in November, and if I stay on the schedule that you have currently, it would be a February meeting. But if the TAC would like, I can always look at Monday, maybe switching the months. I can't promise anything. Some of our odd months are a little bit heavier, but I might be able to move some things around if you wanted to look at a quarterly starting in January versus February.
That would be better.
Okay, I can send that out after the meeting, and I'll take a look at that, kind of with the same week we are and just move it to January.
And if the problems did come up with the implementation of this January 1st, we could always have a special call meeting, I guess, with just that. Okay.
Yes, sir.
So, looking ahead on the agenda here, just never mind item number 9. We'll get there here in just a moment. So let's, I don't know if we have to have I'm assuming we have to have a vote to actually approve the tempo change. So just out of
You don't
procedural.
have to vote.
Okay.
I can
good.
just send out an email, and if you guys like the new schedule, just reply yes, and we'll get it on the books and sent out to everybody. If you don't like the dates, we will we'll mess with them until we get them right and what works best for the TAC.
Okay, sounds great. All right, blowing right through this. Item 6, general discussion. Is there any items that need to be brought up before the TAC today?
Mr. Chair, one thing I would like to just bring up for discussion for future meetings, I think an item that we need to try to tackle beginning next calendar year would be looking at some potential for Medicaid reimbursement for on-scene care, no transport. You know, we're going to see some legislation start to happen at the federal level, and I'd like to see if we can discuss how we can make that happen with the state level and Medicaid.
Okay, very good. And I believe treat no transport was something that DMS has been working on. And if somebody from DMS can update us on that, I believe.
Leanne, Leslie, are
Yes.
one of you guys on?
I'm here.
Oh, thank you, ma'am.
So yes, treat not transport, and I know there's several different variations of that title. I apologize, but CMS did approve that on October 13th of this year, with an anticipated effective date of January 1, with regulations being drafted right now.
Well, thank you.
Okay, that's with did you say that was with CMS?
No, that they approved our SPA,
Okay.
the state plan amendment to be able to reimburse the EMS providers when they go to a scene they treat, but they don't have to transport someone. But that is now a reimbursable service for the EMS.
Okay. Very good. I thought I'd seen something come across at one point that had that address, but I wasn't sure what the status of that was. But is there anything in writing that is appropriate for us to be able to send out to all of the EMS providers that talks about this? Like I said, I think there was a document, but honestly, I don't remember when that came out. And I believe it wasn't after it was approved. I believe it was a meeting we had earlier in the year where we had talked about the treat no transport. So is there anything that has been done since October 13th that addresses it or that talks about what the reimbursement rate is that we could send out to our EMS providers?
That's not me. That'd be someone else. I don't know who's on here that might be able to talk to that.
Okay.
We have, oh, yes, we do have it. I'll send this to Erin, and she can send it out to everyone. I do
Okay.
have like a PowerPoint presentation, and I'll send that out.
Leanne, this is Leslie. I think we've got that one slide
Yep.
that has some projected rates. Okay. Sorry, I stepped away for 2 seconds. I'm sorry.
No, thank you.
With that being projected rates, when will we know what the actual rate will be versus a projection?
Leanne, when's the implementation date on this one? Was that one
Yeah,
is that
we
one
have
January?
Yes, ma'am.
So we should be able to tell you fairly soon. I think what we have proposed is probably gonna stay.
Yeah, that's one line that's in that document that I'll send.
Thank you.
Okay, so in the chat, it said it was gonna be 8250 if it stands, and that was for AO 0429, I believe.
Okay.
Okay,
This is Leslie. I apologize for saying projected because I think that is the rates that are standing.
okay. Very good.
I
And
think
with it being, if it's gonna be done under AO 0429, is there any type of modifier that the billing companies will have to add to show that it was a treat, no transport, so that it doesn't potentially get kicked back?
I think we're gonna have to figure out where we are with the systems changes. Leanne, can we do a follow-up with that? And that's
Yes.
not something that
Yes.
she's necessarily doing. We're just involved because this became part of a continuum for mobile too. It's an offset of it.
Okay,
And hey, this is Bradford Johnson with Myers and Stauffer. I assisted DMS with this piece. And the code that'll actually be billed is the AO 998. Just the way that the state plan was written, it ties it to the rate of AO 429. So if AO 429 ever has a dollar amount change, then the AO 998 would follow it.
Thank you, Bradford. I remember that now.
Thank you.
Thank you for being on.
Yep.
It's been a while since I've looked at it.
okay, great. Jacob, does that answer what you had, or?
I guess the only other question is how this could play into community paramedic services, MIH. That may have to come out when we see the regulations or legislation. Is that correct? Or will this apply to community paramedic services as well?
Sure, that's a fantastic question. And for DMS and the MCOs that are on the line, you may hear community paramedics referred to as mobile integrated healthcare. You may hear it referred to as CP, community paramedicine. Essentially, it's the program where paramedics go out. They can check on patients that have been recently discharged to make sure that they're doing okay. Under contract by hospitals, potentially do it, or if it's a frequent flyer patient that just needs to be checked on to make sure that we can reduce or try to reduce the number of trips that they make to the hospital. There's been a lot of growth in the area of mobile integrated healthcare. But the one thing that has never moved, the needle hasn't moved on, is the reimbursement for doing CP. So that's something that as more and more EMS providers are wanting to do it, especially to try to stem the number of trips for frequent flyers. And I know that's not the politically correct term that we're supposed to use, but those patients that use our services multiple times in a day, we would be able to take care of without necessarily transporting them, and allow them to be seen by a medical provider, so that it's taking away any question of whether or not there is something physically wrong with the patient or not. So this will probably be a topic I'll go ahead and put on our next agenda so that we can brief it more appropriately, especially for the MCOs, because each state does it a little bit differently or a lot differently, depending on what part of the United States you're in. But CP is something that, if done correctly, is a fantastic option for patients. And it's a better utilization of medical resources as opposed to transporting anybody who calls 911 for any reason when they don't really need to be transported or use the 911 system. So I'll put that on the agenda for the next meeting.
Thank you, sir.
Thank you. Appreciate it. Okay, any other general discussion items? If not, we'll jump down to number 7. Any recommendations at this time? Okay, hearing none. Next item is our MAC meeting representation. I believe the next MAC meeting is and I don't have the schedule in front of me, but I believe it's either December or January. Actually, it might be this month.
The next MAC meeting is on the 30th of this month.
Okay, yeah, okay. So November 30th, if you're so inclined and would like to attend the MAC meeting, that will be sent out for those folks. Again, item number 9, where it talks about our next scheduled meeting being February 26th, that will probably change. Let's wait and see what we get from Aaron as far as what the meeting dates would look like. And then as we find that out, I'll get with the committee members individually, and we'll go from there and make sure that we give plenty of notice to the MCOs as to whether we want to start on a January and then go quarterly, or what the decision is on that. All right, I'll open it back up if there's any discussion items for anybody concerning anything before we dismiss. All right. If not, we'll go ahead and call for adjournment. If we have a motion to adjourn.
So moved.
Motion and a second.
Second.
You got a second? Any discussion? All in favor?
Aye.
Opposed? None? Very good. We're adjourned. Very good. For those that are still on here, I hope everybody has a happy holiday season. Please stay safe, and we look forward to seeing everybody at the beginning of the new year. Thanks so much.
Thank you. You too, Keith.
Thanks, everybody.
Thank you.
Bye-bye.